afternoon. We are Group 9 for the Community and Mental Health Nursing course, and we will be presenting today on the mental health issues high-risk groups for substance abuse. Our group consists of four members, namely Angeli Amor, Froyland Manon-Og, Rong, and myself, Janette. Each one of us will present a portion of the discussion today. Our presentation objectives are as follows: to define substance abuse in high-risk groups, to demonstrate the effects of substance abuse, to identify high-risk groups for substance abuse, to identify mental health issues associated with substance abuse, to highlight treatment options, and to identify possible nursing interventions for this population. The World Health Organization defines substance abuse as the harmful or hazardous use of psychoactive substances, including alcohol and illicit drugs. Substance abuse can lead to what is called dependency syndrome, which is a cluster of behavioral, cognitive, and physiological phenomena that develop after repeated substance use and that typically include a strong desire to take the drug, difficulties in controlling its use, persisting in its use despite harmful consequences, a higher priority given to drug use than to other activities and obligations, an increased tolerance, and sometimes a physical withdrawal state. The following statistics regarding substance abuse and mental health disturbances are taken from the Center of Addiction and Mental Health and show us the extent of the problem here within Canada. Every year, 1 in 5 Canadians experience a mental illness or addiction problem. By age 40, 1 in 2 Canadians will have experienced a mental health or addiction problem in their life. Individuals with mental illnesses are 2 times as likely to have substance abuse problems as well. 20% of those with mental illness have concurrent substance abuse problems. In schizophrenia, this statistic can raise to as high as 50%. Mental illness is the leading cause of disability in Canada, and among Ontarians aged 25 to 34 years old, 1 of every 8 deaths is related to opiate use. The effects of substance abuse are both intense and all-encompassing to both the individual and his or her friends and family. The physical effects on the individual are as follows. There are sleep changes, a decreased memory and cognitive abilities, abnormal vital signs like respiration, heart rate, and blood pressure, chest or lung pain, nausea, vomiting, diarrhea, and stomach pain. In addition, skin can be cool and sweating or hot and dry. There's a higher incidence of diseases such as hepatitis B or C or HIV due to the needle sharing. There is a possible impotence. There is a decreased immune system, which results in more frequent illnesses such as the common cold or the flu. And frequent hangovers and blackouts are also a result. So we see the physical effects are quite devastating, but as well the psychological effects on the individual are really life-altering as well. There's a preoccupation with getting the drug. There are mood changes that include depression, anxiety, irritability, aggressiveness. There can be an intense selfishness, sometimes the hopelessness of the individual. There can be a lack of pleasure from previously enjoyed activities, and sometimes the person might pressure others into doing drugs as well, which has its consequences on their relationships. So we see the physical and psychological effects are quite intense. Now we're going to look at the effects on the lifestyle. So there's often a loss of relationship associated with substance abuse as the individual begins to choose the drug over people and their friends and family. And they also are dramatically changed in their behavior and personality. And so this can further distance people from their relationships that exist. We can also often see poor performance at work or at school. And this can result in disciplinary action or even a loss of their position at either school or work. As well, we can see a discontinuation of interest in hobbies. Again, another place where relationships can be lost as well, as that individual begins to pull away from all the things that previously interested them. And so in this as well, we can see some of the financial effects that may happen. That an individual loses their job, loses their spot in school, loses relationships with roommates or things like that. We have a financial issue and perhaps a housing issue as well. So the effects are profound and dramatic and all-encompassing. Now I'm going to turn it over to my colleague, Rong, who will continue the discussion from here.
Hi, Joyce. This is Suro. My part is going to discuss about risk factors for prescription drug abuse. Risk factors for prescription drug abuse usually include past or present addictions to other substance use, including alcohol and tobacco, family history of substance abuse problems, younger age, especially the teens or at early 20s, certain pre-existing psychiatric problems, or exposure to peer pressure or social environment where there's drug use. Is there access to prescription drugs, such as having prescription medications in the home medicine cabinet? Lack of knowledge about prescription drugs and their potential harm. Older adults and prescription drug abuse is a growing problem, especially when they combine drugs with alcohol. Having multiple health problems and taking multiple drugs can put seniors at a risk of misusing drugs or becoming addicted. Thank you.
Hi, my name is Angeli and I'm going to discuss about the mental health issues associated with substance abuse. Having a substance abuse problem and a mental issue such as depression, bipolar disorder, or anxiety is called a co-occurring disorder or dual diagnosis. Having a dual diagnosis can make recovery more challenging. For the first one is depression. Many of the factors that contribute to depression also play a part in substance use disorder. Imbalances in brain chemistry, family history, and past trauma, for instance, are frequently involved in both depression and addiction. In addition, the physical and psychological effects of addiction may mask the signs of depression or worsen the symptoms of this psychiatric illness. Alcohol and drug abuse can worsen the course of a depressive disorder by aggravating the symptoms of depression, increasing the likelihood of hospitalization and interfering with the course of treatment. Individuals who are being treated for depression while using drugs or alcohol are unlikely to see positive outcomes from therapy. Substance abuse impairs motivation and decreases the effectiveness of therapeutic interventions. In addition, alcohol or drugs can have dangerous interactions with the medication used to treat depression. Some of its signs and symptoms are feeling of helplessness and hopelessness, loss of interest in daily activities, inability to experience pleasure, appetite or weight changes, sleep changes, loss of energy, strong feelings of worthlessness or guilt, concentration problems, anger, physical pain, and reckless behavior, especially in men. For the bipolar disorder, one of the reasons for this phenomenon is an individual attempt to self-medicate with drugs and alcohol to numb the painful symptoms of their bipolar disorder. Symptoms of bipolar disorder such as anxiety, pain, depression, and sleeplessness are so alarming that many individuals will turn to drugs and alcohol as a means for offsetting that discomfort. According to National Institute of Mental Health, drinking alcohol or using drugs may trigger depressed or manic moods in someone with bipolar disorder. Some of the signs and symptoms of bipolar disorder are feeling of euphoria or extreme irritability, unrealistic grandiose beliefs, decreased need for sleep, increased energy, rapid speech and racing thoughts, impaired judgment and impulsivity, hyperactivity, anger, or rage. The last one is anxiety. People initially develop an anxiety disorder, start self-medicating with drugs of abuse, and end up with a dual problem, anxiety and addiction. In some other ways, someone begins using a drug of abuse and then develops an anxiety disorder as a consequence of their addiction. The signs and symptoms of anxiety are excessive tension and worry, feeling restlessness or jumpy, irritability or feeling on edge, racing heart or shortness of breath, nausea, trembling or dizziness, muscle tension, headache, trouble concentrating, and insomnia. Thank you. The next presenter is from.
Hello, I am Froyland, and I will be discussing about the goals of substance abuse treatment. So before I start, I got a question. Can drug addiction be treated? Yes, but it's not simple. Because addiction is a chronic disease, people can simply stop using drugs for a few days and can be cured. Most patients need long-term or repeated care to stop using completely and recover their lives. So some of the goals of substance abuse treatment are the following. So stop using drugs. So this is according to the National Institute of Drug Abuse. So one of the aims is to stop using drugs. Second is to stay drug free. And third, be productive in the family, at work, and in society. So some of the treatment for substance abuse are the following. So opioids or methadone, brand name Dolophin, methadose, buprenorphine, brand name Subuxone, Subutex, Probuphine, and naltrexone, brand name Vivitrol, are used to treat opioid addiction. For tobacco, nicotine replacement therapies are used, since this has several forms, including the patch, spray, gum, and lozenges. These products are also available over the counter, and the medications are more effective when combined with behavioral treatment such as group and individual therapy as well as telephone guidelines. For alcohol addiction treatment, there are three medications have been approved by the FDA for treating alcohol addiction, and a fourth, topiramate, has shown a promise in clinical trials. This is during large-scale studies with people. So the three approved medications are as follows. So naltrexone, acamprosate, and disulfiram. So let's first discuss about naltrexone. So naltrexone reduces the relapse to heavy drinking and is highly effective in some patients. Second medication is acamprosate, brand name Camprol, may reduce symptoms of long-lasting withdrawal, such as insomnia, anxiety, restlessness, and dysphoria, which is, we all know, the general feeling of unwell or being unhappy. Third is disulfiram, or brand name Antabuse. This interferes with the breakdown of alcohol. So compliance can be a problem, but it may help patients who are highly motivated to quit drinking. Some of the nursing priorities according to FIRA are the following. So first is to provide support for decision to stop substance abuse. Second, strengthen individual coping skills. Third, facilitate learning of new ways to reduce anxiety. Fourth, promote family involvement in rehabilitation programs. Fifth, facilitate family growth and development. And finally, we will be providing information about condition, prognosis, and treatment. Okay, that's all for the nursing priorities. Let's go to the group's conclusion. So the group concludes that change usually starts from oneself. Without the eagerness of one client to change, treatment plan and interventions will be futile. It is essential that nurses and healthcare professionals provide adequate planning to address issues along the course of treatment. It should be kept in mind that regardless of the situation, we are ought to provide dignified and holistic care to our clients. However, boundaries and limitations are to be set when it is deemed unsafe to practice with the client. Thank you for watching our presentation. I hope you enjoyed watching this. So if you get questions or clarification, do not hesitate to send us a message or email through our Blackboard online. Thank you. So here are some of the references that we use in our presentation, including the images.